Fox 5 Health News, AstraZeneca. Fox 5 Health News, AstraZeneca revising its efficacy data for its COVID vaccine. Earlier in the week, an independent review panel accused the company of cherry-picking its data.
All right, joining us now, Dr. Purvi Parikh, Clinical Assistant Professor of Infectious Diseases and Immunology at NYU Langone. And obviously, you know, the idea, we want the more vaccines, the merrier, but the big picture here is the concern about whether this erodes public trust over the whole vaccine situation in general when we hear these allegations being put out there.
Right. You know, it's a little bit unfortunate because I think AstraZeneca rushed to release information on Monday, which didn't include confirmed COVID cases that occurred in February. So from their updated information, the good news is the efficacy actually didn't change dramatically. So from 79% effective overall, it went down just a little bit to 76%. But actually, they found it was more effective in people over 65. So it went from 80%, what they initially said, to 85% with the new data. The other good news is it still prevents deaths. It still prevents hospitalizations completely. But unfortunately, this does kind of erode trust, as you said. But I'm glad that it shows that those safety checks are in place, that the independent boards are still, you know, putting these companies accountable.
Right, that I guess is the flip side about the system worked in this case, so that is the good news.
I want to ask you something else, doctor. A new report finds that women have been skipping regular checkups and treatments during the pandemic. I can think of a million reasons why, but what have you found?
Right. You know, it's problematic because women already seek medical attention less than men because their caregivers have responsibilities. And then we found that during the pandemic that especially women who had Medicaid or who were from lower income or uninsured sought medical attention even less so. So that's even widening those gaps and missing on crucial checkups, even emergencies in some cases. And then they kind of found it across the board. Even women of higher income and, you know, those with private insurance also didn't seek medical care as routinely as men did. So that unfortunately widens that already existing health inequity and puts them at risk of developing more problems and more complications. The good news is now we are using telemedicine and telehealth a lot more, so hopefully that will help bridge the gap.
Indeed, yeah, because that's important. You don't want to slide on those meetings, but it is a convenient excuse, you know,
really
because I know there's a temptation not to, but you got to do it. All right, Dr. Parikh, we appreciate it. Thank you.
Thank you.